Greetings, Toby Kohler back again for Mayo Men's Health Moment. Today we're going to talk about an overview for treatments of erectile dysfunction. So today I'd like to talk about what are the different options for ED. Well, like many other medical conditions, the first thing that you can do to address problem with erections involves lifestyle change. All of these different treatments approaches should have separate videos describing them in greater detail. But at the end of the day, if you make significant changes in terms of diet, exercise, weight loss, you can improve your erections almost as powerfully as pills can do by themselves. If you've attempted lifestyle change and this no longer works, or it simply isn't good enough, the next logical choice is to use pills. Broadly, the pills are called phosphodiesterase inhibitors, or PDE5Is. Phosphodiesterase inhibitors are found throughout the body, but specifically there's a lot of them in the penis, and so these medications can really help with problems with erections. Overall, they help about 2/3 of men that try them. 1/3 of men who try these types of pills, they won't be effective because their penis is too sick for them to help. And of the men who do get an effect from the pills, they last on average about 5 years. Again, if you take good care of yourself and you maintain how healthy you currently are, then these pills can last a lot longer. However, on average 5 years in the general population. Another treatment approach for problems with erections are to use devices, vacuum erection devices specifically, and a new kid on the block are traction devices, which are unproven but worth mentioning at this point because there's more data coming out on how they may be effective. The vacuum erection device has been around for a very long time. You can see pictured on the screen here is a vacuum erection device, and what comes with the kind of kit that you get if you do purchase these devices. They're in the range of $300 to $400. Typically, this product here is from Gesiva Medical, a brand that we happen to use in Rochester, and it's effective for some men. And I also use it in context of helping to kind of bring the penis back to life if there's any problem after surgery, for example, or penile shortening after certain surgeries. The vacuum erection device can be used as an aid, not only for sometimes for intercourse itself, and in that case you'd have to use the ring pictured there, but also to help rehabilitate the penis either after surgery in the pelvis or to help prepare for a penile implant procedure. Another approach you can use is Muse, or medicated urethral suppository. This involves inserting a small pellet into the urethra. It's relatively painless, and you kind of put the pellet in there and wait a little bit, and the medication will actually dissolve in the urethra, or the urinary tube, and make its way into the penis, and that can cause erections. The same chemical is used in penile injections. It's Elprosadil, or you can use a combination of chemicals called trimix, 3 medications, which are papaverin, phentolamine, and prostaglandin E1, for those taking notes. And that combination can help cause an erection. What patients have to do is draw up their own medication when they want to have sex, and then they will inject the medicine into their penis as pictured here. So this sounds painful and like, why would I ever want to do this? But it's actually quite reasonable, not that painful, and it's affordable, somewhere in the order of $5 to $10 per erection with the right dosing. Another option is surgery. The surgery to fix erectile dysfunction involves using penile implants. Here's a penile implant pictured on the screen as well. The kind of best version of the device is a 3-piece device in which it has cylinders, pump, and reservoir as pictured here. Please see my other videos. There's a bunch of different surgery videos. And finally, I did make one other video about scam treatments. So there are many emails that you receive, late night commercials claiming, incredible results with different types of pills or kind of different therapies. At the end of the day, a lot of these don't have any evidence and aren't really great treatments. So please watch that video, Scam Treatments for ED, to learn a little bit more about that and educate yourself and potentially save a lot of money in buying a product that isn't really going to help you. I'd like to wrap up today's video by going over the recent updates to the AOA Guidelines. So the AOA is the American Urologic Association, and their mission is to help improve urologic care in the world. And so there's a panel that meets on various topics every few years. And so the panel recently met in 2018 to describe erectile dysfunction treatments. So historically, the old guidelines would say, okay, if a man comes to you with problems with erections, the first thing you have to tell them to do is lifestyle change. If that fails, then you can give them pills. If that fails, then you give them vacuum devices. If the vacuum fails, then you tell them to use penile shots. And if that finally fails, then you switch to surgery. So this is a stepwise approach, kind of going from least invasive, least risk to most invasive, most risk. Recently, in this updated version, the panel has decided that it isn't necessary to do this stepwise approach. Indeed, they think it's kind of outdated. And, right now they say the panel advocates the use of treatment framework that is not predicated on men progressing through ED treatments in order of invasiveness or reversibility. Any type of treatment as an initial treatment is a valid choice. So now the advice is for physicians, urologists, surgeons, whoever the doctor is to have shared decision-making with the patient to go over all the options initially and then pick the one that works best for you. The problem with using a stepwise approach is often patients who really have a sick penis to start with will be given lifestyle change and pills or even some of these devices, and they won't work. And so then they'll spin their wheels for 5 years trying these treatments that are really never truly effective. So the point is, if you want to fix your problems with erections, the first time you see a physician with penile injections or with surgery, that is a reasonable choice if you're fully aware of the risks and benefits of all the different treatments. Well, thanks for watching. If you have any questions or would like to schedule an appointment with us, please call the number on the screen. Otherwise, we'll see you next time. Toby Kohler signing off. Mayo Men's Health Moment, Rochester, Minnesota.